following video is a brief overview of testosterone replacement therapy. The information contained in this video is in no way meant to diagnose or treat anyone who suspects they may have a medical condition. If you think you may have any of the signs or symptoms of low testosterone, you should schedule an appointment with your physician to get yourself evaluated and tested. NovaGenix Testosterone Replacement, TRT Basics for Men Starting Therapy. Testosterone is a hormone that is produced primarily in the testes. Although it's mainly considered a male hormone, females produce lesser amounts as well. It's typically responsible for producing the secondary sexual characteristics most often associated with being a man, such as deeper voices, more muscle mass and facial and body hair. Testosterone helps men to maintain bone mineral density, body fat distribution, both muscle mass and strength, body and facial hair, the production of red blood cells, their libido and sex drive, and the production of sperm. Typical levels in a man will range between 250 nanograms per deciliter all the way up to 1100 nanograms per deciliter on the higher end. These variations will take into account such factors as age, lifestyle choices, genetics, and overall health and well-being. So what are the signs of low testosterone? There's many signs and symptoms, but some of the more common are the following. Changes in a man's sexual function. This could include a lowered libido or sex drive, a man achieving less spontaneous erections, both waking and during sleep, as well as infertility from decreased sperm production. There also may be a change in a man's sleep patterns. Often, low T can cause poor sleep quality, manifesting itself into insomnia or other sleep problems. There may be physical changes in the body as well. One of the most common signs of low T, this may include increases in body fat, especially around the stomach area, decreases in lean muscle mass and less strength, and decreases in bone mineral density. Fatigue and having less energy than you used to have is also extremely common in men with low testosterone. Emotional changes are also very common. Low T can also cause a decrease in self-confidence, drive, and motivation. You may experience mood swings, depression, or have what's called brain fog, which would be trouble concentrating on things and poor memory. So how do you know if you have low testosterone? The best way to find out if you have low T is through an actual blood test. Your doctor may want to check for several markers such as your free and total testosterone, estradiol, sex hormone binding globulin, prolactin, FSH, LH, a prostate-specific antigen test, thyroid tests such as a TSH, T3, and T4, as well as complete blood count and complete metabolic panel. These tests will paint a total picture of your hormonal health and may point to underlying causes to your signs and symptoms. An ADAM test can also help. It stands for androgen deficiency in aging males and lists some of the most common signs and symptoms of low testosterone. A physical exam and medical history will also shed light on a patient's hormone levels. Information that could be useful may include past injuries, surgeries, family history, chronic illnesses and medications, as well as lifestyle issues that may include job-related stress or family issues, substance abuse, alcohol consumption, smoking, and diet, and more. What is the ADAM test? The ADAM test stands for Androgen Deficiency in Aging Males. It's a 10-question yes or no questionnaire designed to find out whether or not a man has some of the signs or symptoms of low T. Questions such as, do you have a decrease in libido or sex drive? Do you have a lack of energy? Do you have a decrease in strength and or endurance? Have you lost weight? Have you noticed a decreased enjoyment of life? Are you sad and or grumpy? Are your erections less strong? Have you noticed the recent deterioration in your ability to play sports? Are you falling asleep after dinner? Has there been a recent deterioration in your work performance? These questions reflect some of the signs and symptoms of suboptimal testosterone and can give a physician some valuable insight as to whether or not you may be a candidate for a testosterone replacement therapy. What are some of the benefits of TRT? Some of the potential benefits of testosterone replacement therapy include a vast improvement in libido or sex drive, sexual desire and performance function. There is an increased ability to achieve and maintain erections. There's increased bone mineral density leading to stronger bones. Men will show improved confidence, better moods, overall increases in energy and quality of life. There will be changes in body composition such as decreased body fat and improvement in lean muscle mass and overall strength. Tests have also shown that TRT can help improve cognitive function and decrease brain fog. As with taking any medication, there could be side effects. So, what are the risks of testosterone therapy? Testosterone therapy has various risks, and most can easily be treated with a good protocol from an experienced physician and give plenty of warning signs prior to them becoming problematic. For example, testosterone therapy could exacerbate sleep apnea, which is a sleep disorder that causes breathing to stop and start repeatedly at night, typically in larger, more obese patients. TRT could cause the patient to develop acne, often when their levels are too high. TRT may stimulate benign prostatic hyperplasia or cause enlargement of the prostate, the non-cancerous type, which is why patients that do have prostate cancer should refrain from starting TRT in an effort to reduce any aggravation of their condition. TRT can also cause enlargement of the breast, otherwise known as gynecomastia, which may be due to unchecked estrogen levels. TRT could cause lower sperm production and cause testicular atrophy or shrinkage when someone is not taking HCG while on TRT. And finally, TRT could increase the production of red blood cells, which may cause an increased risk for blood clots or even stroke, which is why monitoring hematocrit levels is so important, and getting follow-up blood work done every few months is paramount to a good protocol, and that is something that would be undertaken by an experienced physician. Testosterone as a medication can be taken in several forms. The most popular seems to be testosterone cypionate. Sometimes patients will prefer enanthate or propionate, but the strength and dose may vary, as well as the ester or suspension. Typically, you may find grapeseed, cottonseed, or sesame seed oil as the oil testosterone is contained in. Frequently, it depends on the type of testosterone and are most commonly taken weekly, biweekly, or in some cases daily, depending on the patient's preference and protocol. Also popular are gels or creams that can vary in strength or percentage of testosterone. These transdermal medications allow testosterone to enter the bloodstream through the skin, much like testosterone patches. These need to be applied every day. Pellets may also be inserted into the skin and are slow releasing, but can be difficult to make adjustments to once they are inserted. Pills and capsules as well as sublingual troches are also available, but may cause problems with the patient's liver, so those are usually less commonly prescribed. What is HCG and why take it when on TRT? Well, for men, doctors often will prescribe HCG, also known as human chorionic gonadotropin, to fight the symptoms of low T and infertility. HCG is a polypeptide hormone which works to stimulate the testes due to the similarity to naturally occurring LH or luteinizing hormone and FSH or follicle stimulating hormone, which normally stimulates testosterone and sperm production in men. When taking testosterone injections while on TRT, the pituitary gland will stop sending signals to the testes over time, and they may atrophy and shrink in size, which leads to a decrease in natural testosterone production and a decline in spermatogenesis, resulting in possible decreases in fertility. HCG is self-administered by the patient as an injection into the subcutaneous fat with a small 29 to 30 gauge insulin needle. The dosage may vary, but because it stays in the body for around 3 days, doctors usually prescribe 250 to 500 IUs once or twice weekly to prevent shrinkage of the testes and to help stabilize men's hormone levels while on TRT. So how much does testosterone therapy cost? Well, the cost will depend on what medications you may need, but if you have health insurance and need TRT to treat a health condition and your plan will actually cover it, you likely won't pay the full amount. The actual costs may also vary based on where you live and whether there's a generic version available. Generally, you can expect to pay anywhere from $20 to $1,000 per month. I know that's a huge variation, but with insurance plans and different clinics offering different medications and protocols, I've seen incredible amounts being charged for TRT. Most compounding pharmacies, fortunately, can make it very affordable and offer excellent products. When using the compounding pharmacies, you can pay between $150 and $300 a month on average for excellent care, excellent products, and that's obviously for cash pay patients, not using insurance. Often insurance companies will only cover a portion of your medication and not even all the medications you need. HCG and anastrozole, for example, are prescribed for TRT patients as an off-label medication, so many insurance plans won't even cover them. They may cover office visits, and some providers as a result will require more frequent in-person visitations, which is very inconvenient. They may also only cover you if you show 3 tests in a row where your levels fall well below the normal ranges, which limits most men, even if they're in the bottom 10% of normal values. So, for example, a 30-year-old with a testosterone level of 270 may not even qualify for TRT through their insurance because technically they're within normal values. If you would like to learn more about testosterone replacement therapy, please visit our website at www.novagenix.org and call 561 277 8260 to schedule a consultation today.